In this presentation, we present our project for asthma control, a clinical decision support application. This project is inspired by Sidwin Kamgang and Kathy Bailey, external mentors who are collaborating with our team, the Epidemics. Our team members are Ramesh Manian, Arsh Talati, Charity Lashinsky, Eric Lashinsky, Scott Greiner, and Matthew Hull. In the U.S., there are approximately 22 million people with asthma, 6 million of which are children. The American Academy of Allergy, Asthma, and Immunology states that the number of people with asthma continues to grow. 1 in 12 had asthma in 2009, compared with 1 in 14 in 2001. The World Health Organization reports that approximately 250,000 people die prematurely each year from asthma. Almost all of these deaths are avoidable. There is no silver bullet for treating asthma. The management of the disease varies depending on disease severity, age, and seasonality, to name a few factors. Treatment strategies include prescribing long and short-term medications, use of preventers such as inhalers, and environmental measures. Patient needs motivate our business case for this application. It is evident that a patient must commit to an ongoing effort of deciding asthma control level along with proper medications, which change based on the age of the patient and the control level. Care providers and patients must be cognizant of potential conflicts in prescribed medications and must complete regular follow-ups to adjust and maintain the therapy and medication as needed. Treatment also requires monitoring and transmitting of vitals and assessments to the care provider at regular intervals. The National Heart, Lung, and Blood Institute commissioned an expert panel to develop and disseminate guidelines for the diagnosis and management of asthma. Known as EPR3, the panel reviews literature and develops the essential components of asthma care. Our application aims to enable patients and care to more efficiently manage and control asthma by being able to complete an assessment using the app. The assessment is transmitted to the care provider, who can view the information along with the EPR3 recommendations for clinical decision support. The care provider makes adjustments to treatment as necessary and transmits the information back to the patient.
Hello, my name is Eric Lashinsky, and I'd like to discuss the business case for our asthma control project. To get a feel for the severity of the problem, consider the human costs of asthma. 3,615 people die every year from asthma, and these deaths are often preventable had the user been more prepared with education or equipment. There is no known cure for asthma on the market because the condition is an expression of the body itself and is a feedback loop from cells in the lungs. With access to proper equipment, asthma can be mitigated to the point where flare-ups are rare, but still education is required. Another alternative to decrease the damage caused by asthma is to use pre-existing asthma management tracking websites such as myasthma.com, which has a wealth of information about mitigation techniques and information. One drawback with this website is that it doesn't have features to coordinate with healthcare providers through the FHIR APIs. So we propose our interactive website solution that will be accessible through the browser on a desktop, laptop, or handheld device that allows the user to enter information and get feedback on optimal asthma mitigation strategies. The website has many advantages to both users and the healthcare providers. Patients get more accurate information and focus on understanding the problem thoroughly enough to take care of it themselves. Our website will always be available for just-in-time strategies in the middle of the night, and the user doesn't have to wait a few days for a 15-minute consultation with a doctor. Finally, I discuss features and implementation of the website. First, we interact with users and assess the risk factors of the user. Then we suggest optimal mitigation techniques, medicines, or equipment. Education is continuous between patient and provider and adjusts to handle the flare-ups. FHIR APIs exchange information between the healthcare provider and user. The goal of our website is for the user to have everything they need in a handheld device to be relatively sure that they are doing everything they can do to prevent asthma flare-ups that end in a catastrophic consequence. Slide 11 shows the Gantt chart and the project plan for allocation of resources. Thank you.